fingered Sierra. Thank you all for having me. We're all living in a resource-rich country that no longer sees the many challenges that poor resource countries have to face. One of the challenges that women in these countries face are obstetric fistulas. So you guys probably don't know what that is. An obstetric fistula is a hole or a tiny tear in the tissue wall. During prolonged obstructed labor, the baby's head causes a lack of blood flow to the neighboring tissues, causing necrosis, so cell death or tissue death. The death of this tissue is eventually going to lead to a fistula. Now, there are different types of fistulas. There can be a tear between the vagina and the bladder, causing a VVF, a vesicovaginal fistula, or there can be a tear between the rectum and the vagina, known as an RVF, of rectovaginal fistula. I've drawn a picture on the board to give you guys a better visual of where a fistula would be located or what it would look like. So this is the female anatomy. Here we have the bladder, here we have the uterus, here we have the rectum. This is the vagina, also known as the birthing canal. When a woman is pregnant, the baby would be placed here in the uterus, and this would be extremely expanded, making the lining of these walls very thin and close together. When there is an obstruction, which can happen anywhere from 12 hours to 4 days, there is no blood flow to these tissues. The tissue dies, causing a tear or a hole in this area. So when there is a hole between the bladder and the vagina, urine can seep through this area down the vagina, causing urinary incontinence. When there is a hole from the rectum to the vagina, fecal matter, which is in the rectum, seeps through the vagina, causing fecal incontinence. In some cases, a woman can have both. According to Obstetric Fistula, the challenge to human rights, fistulas arise from early marriages. They arise from birthing before the pelvis is adequately developed. They develop from malnutrition, from lack of obstetric care, due to either poverty or due to lack of transportation to facilities that can help. So remember, these injuries are occurring in these undeveloped countries, such as Kenya, such as Nigeria, such as Uganda, India, Pakistan, Afghanistan, Nepal, etc., where the nearest medical facility can be hours away from the villages where these women reside, causing women to just give birth at home. When there are complications, there's nowhere to go. They have to deal with the consequences, which in this case are obstetric fistulas. Women that develop fistulas usually birth stillborn babies. So due to the obstruction, the baby has no oxygen and dies. Babies, 99% of the time, are never alive. The social and emotional implications of fistulas are really horrendous. Women are forced to live a life of isolation. The majority, if not all the time, their husbands divorce them due to embarrassment and shame. They believe that their wives are now worthless or useless because they are unable to cook. Their hygiene is compromised. They are unable to have children. They are unable to interact with visitors. These women are then forced back home to their families. However, even their families disown, socially neglect, or ban the women from home. The reason these women are neglected is that they emit offensive odor of urine or feces due to the incontinence. Many women are unaware of the fact that their fistulas can be repaired, so women could go years living with these conditions. Their poverty leaves them unable to seek medical help. It leaves them unable to afford supplies for sanitation purposes, forcing them into a life of prostitution and begging. These women literally leg for their livelihood. These conditions change affected women's lives forever. They're never the same, socially, emotionally, financially. Here in the United States, other well-developed countries, we've been able to eradicate obstetric fistulas. In the case of an obstruction, women are given cesarean surgeries. This is the procedure where the baby is delivered through an incision in the abdomen. So I've drawn a picture here again. This is a pregnant woman. When the baby is unable to go through the birthing canal, a surgeon or an OB doctor will make an incision here in the abdomen and take the baby out through that area, sew it up, and there's never an obstruction. It never allows for a fistula to occur. It'll be very difficult to reach this level of progress in the countries mentioned before. There is so much to improve. We need to improve the knowledge of preventative measures. We need more clinicians trained to perform fistula surgeries. We need more obstetric care facilities. We need facilities that will house fistula procedures. We need transportation to medical facilities. We need roads built for transportation to occur. However, there are many organizations that are contributing to correcting this condition. There are organizations such as the Women's Dignity Project, organizations such as International Federal of Gynecology and Obstetrics, the United Nations Population Fund, and so many more. If you guys want to learn more or even donate to facilities that house these women in order to correct their conditions, you guys can log on to fistulafoundation.org. You can read about their mission to perform life-transforming restorative surgery. According to their website, they've performed these surgeries in over 31 countries. And thanks to donors and willing clinicians, I think we should all help to try and make a change. I'm going to show you guys a video now of a procedure done to correct fistulas, and I'll explain it. So this is a fistula between the rectum and the vagina. They are cleaning the necrotic tissue, and they are using a plug which is 100% absorbable by the body. The cells in the body are then going to absorb this plug and start creating and making new tissue, sealing the fistula that was once there. And this will in turn cause there to be nothing there, as if, yeah. Okay guys, thank you so much. Thank you for having me.